Get right along. Good to see you back in the room again. You know, uh, these in-person briefings were not in place, and I'm happy to be back here in front of you and have an opportunity to just give you an update on some good news. And again, we want to apologize that we have to depart soon. Stephen McDonald's event is today. I remember when he was shot when I was a police officer. I'm happy to be with the family today. But before we get on our COVID briefing, which I believe is going to be some great news, just want to really touch on the horrific incident that took place over the weekend. Former transit cop, I know the safety and how safety matters in our transportation system. It was extremely impactful for New Yorkers, and I spoke with various communities, did a Zoom here from the office, losing a New Yorker in that fashion, and just really doubled down on our concerns that our system must be safe. It must be safe from actual crime, which we are going to do, and it must be safe from those who feel as though there's a total level of disorder in our subway system. Day one, January 1, when I took the train, I saw the homelessness, the yelling, the screaming early in the morning, crimes right outside the platform. We know we have a job to do, and we're going to do both. We're going to drive down crime, and we're going to make sure New Yorkers feel safe in our subway system, and they don't feel that way now. I don't feel that way when I take the train every day or when I'm moving throughout our transportation system. That is our battle, and that is what I'm going to do as the mayor of the city of New York. Also want to acknowledge Dr. King's weekend, an important weekend for all of us, and it really personifies that we have so much work to do as New Yorkers to deal with the battle of ending inequality in our city. And we are committed to do that with the team we put together. And New Yorkers, notice I have not said this at all. I didn't point to the previous administration and talk about what they did or didn't do. We hit the ground running in this city. And we stated it is our responsibility, and we want the ball in our hand right now to turn our city around. Not what happened under previous administrations, but right now in this city, it's the Adams administration, and I have an obligation to make you safe and to deal with the inequalities that we're facing every day. As we mourn the deaths of those in the Bronx fire, bringing in the resources, I'm proud of everyday New Yorkers. We brought in millions of dollars to help the residents. We're going to look at what went wrong there and make sure that our agencies come up with a real plan, just as we did after the Happy Land fire that also took place in the Bronx. We can't have these tragic incidents happen in our city, and we're going to do everything possible to prevent that. And our hearts goes out to the families as we attended the funeral services and really stood by the members of the Bronx as they went through this horrific period, announced the potential of new legislation with the senator. Yesterday, Senator Gillibrand and Richie Torres, the congressperson, to look at the legislation that we also introduced here in the city when he was a city council person. And we are thankful for the response from our entire city as we move forward in this difficult time. We want to just give you some good news on the COVID front, that it is imperative that we show New Yorkers that we are coming back, and we're coming back stronger. Our schools are open, and I want to thank you, Chancellor Banks. We were clear from the beginning, and I don't want anyone to get this mixed up. Our schools are going to remain open. We are not going to do anything that is going to stop our children from coming into schools. We said this over and over again. So please hear me, New Yorkers. Our schools are going to remain open. This city is moving in the right direction. New York is should be proud of themselves. One of our success in moving our city back to a positive place is that we have the highest vax rates in the nations. And it's because of our work. We listened to the call, you told neighbors and friends, you sent a clear message that vaccinations and booster shots are successful. And this work, we just crossed the 16 million doses administered in New York City, including 2.5 million booster shots. We need to really commend everyday New Yorkers, but we have work to do. We're nowhere near where we ought to be, and we want to move even further to make sure that we get everyone boosted and vaccinated in the city. And this is going to help us get our lives back. It's going to help us open our city and do the things that we want to do, get boosted and get vaccinated. And this is going to include our kids 12 and older. Let's take full advantage of modern science coming together to solve this pandemic. But there's also more good news. And thanks to the actions of New Yorkers, Omicron wave is seriously, we're managing it in a real way, and Dr. Chosky would talk about that a little later. The level of cases in New York City, they are declining. They are declining. We know that there's work to do, and that there still remain a very high level, but we're seeing a leveling off, and we're seeing a decline because of what you did. You responded accordingly to this threat. But New Yorkers, we have not won yet. We have more to do, as I want to continue to say that over and over again. But let's be clear on this. We are winning. We are winning. And we are going to win because we're resilient. As I say over and over again, because we're New Yorkers. We're going to continue to monitor this closely. And now remember that hospitalization and death rates lag behind cases, so these indicators may peak later than actual cases are being shown, but we are winning and we're moving in the right direction. And we'll continue to do the trending in the right direction. But as New Yorkers, we must remain vigilant. And those are the simple things that empower us. We have to wear our mask, social distancing, washing our hands, avoiding crowded spaces without ensuring those who are there have went through the proper protocol of being vaccinated, and in many cases, boosters. And we're going to continue to encourage everyday New Yorkers, I'm going to say it over and over again, to be vaccinated and boosted. Because when you're getting vaccinated, it will allow us to keep our city moving forward. It will allow us to do the things we want to do. During the next few days, I'm going to head to the theater and head to a restaurant just to really show the energy that let's get back out in a safe way to make sure we visit our restaurants and bring the tourism back to our city. And this is how we support our small businesses and get our economy up and operating. Your actions are making a difference, New Yorkers, and these numbers prove it. And so thanks to your hard work, we have been able to keep our schools open so far. My administration determined at day one, we were not closing our schools. While other cities closed around us, we were clear in our message. We did not give parents the uncertainty that we have viewed previously. We were very clear our schools were going to remain open, and we pushed through the thoughts that the schools were going to close, and parents had a foundational understanding that their children had a place to go in the morning, and I'm really proud of what the chancellor and his team did. We made two big changes during the school year that brought about the success we believe we're witnessing now. Number one, we distributed 4.5 million at-home rapid COVID tests, and an unbelievable distribution, coordination between school administrators, law enforcement, governmental agencies, our team here to get those tests in the hands of children. These rapid tests, which is very important, identified 25,000 additional people reported cases. This allowed us to isolate these cases so we would not have the spread based on the data that because a child was infected in school or at school or had COVID, it did not rapidly spread throughout the classroom. So we were able to use the science, the facts, and not fear to properly deploy the resources where they were needed. And I'm really proud of that. And those are thousands of cases that we were able to isolate. And it prevented thousands of more people from being infected with COVID. They were allowed to protect themselves and protect the school community while in-person learning continued. Second thing, we doubled down on PCR surveillance testing, going from 10% to 20%. Doubling the CDC and New York State standards. We led the way. We did not allow the standards of the CDC and New York State to get in the way of what we thought we had to do in our school system to protect our children. We doubled them, and the success showed that we were capable of doing so. The numbers that this program showed, increasing testing works. That was what we started out with. That is what we stated, and we were successful in doing so. We're going to continue to ensure that home test kits will go to every child that needs it to make sure that they can take the proper precaution as we move forward. And so I'm excited about what we have accomplished. And you should be excited, New Yorkers, on what we were able to accomplish. As we're watching our response to this strand, we responded, and we understood the complexity of this. I stated from the beginning, on January 1st, we had to learn to live with COVID. We had to learn to be smarter and outsmart this virus by using modern-day science and what we can do to empower New Yorkers. We have to get our city up and operating again. Our economy depends on it, and the safety of our families depends on it. We're going to make smart decisions to make sure that we're not harmful to the future of our children and we're not harmful to the future of this city. And we're doing that. And we're prepared for this moment. This is a time when we can come together as New Yorkers and make the right choices to keep us moving and trending in the right direction. And so I'm going to bring on an amazing public servant who has been here with us throughout this entire journey with our team, Dr. Chassi.
So much, Mr. Mayor. And thank you again, because Omicron has proven to be the most formidable variant yet. But thanks to your leadership, New York City has risen to the challenge. We brought to bear every single tool at our disposal: vaccines, testing, high-quality masks, distancing, and ventilation. And Mayor Adams's 6-point winter pandemic plan prioritized our most important settings, such as hospitals and schools. Massively expanding testing in schools this month, thanks to Dr. Long and Dr. Katz, helped over 25,000 students and staff isolate more quickly, breaking chains of transmission. Meanwhile, testing and our other layered safety measures supported in-person learning. Last semester, we had almost 4 times as many student days in person as the 2020-21 school year. And this semester, with our adjusted quarantine policies, we are on track for even more. New York City has been able to safely reopen schools, thanks to our educators and our chancellor, even when many other large school districts could not. We did it in September despite the Delta wave, and with Mayor Adams's Stay Safe, Stay Open plan, we did it again this month, even with Omicron. And beyond schools, since January 1st, we've distributed nearly 1 million masks to high-risk settings, such as adult care facilities, and to neighborhoods hardest hit by the pandemic through our community partners and through our health department action centers. With these steps, we are on the downslope from the Omicron summit, though we still have more work to do to reach the base. Our 7-day average of daily new cases is under 20,000. That's less than half the peak of nearly 43,000 average new cases a day earlier in January. Similarly, we are starting to see a decrease in COVID-19 hospitalizations from a total of about 6,500 patients hospitalized citywide on January 11th to about 5,800 as of Sunday, according to state data. Now, let me be clear. These numbers are still very high, meaning community transmission remains widespread, and we will need to follow these trends closely over the coming days and weeks. I know that the Omicron wave has already affected so many families, neighbors, friends, and colleagues, including some vaccinated New Yorkers who got COVID. Let's make sure this isn't a cause for confusion. If you are vaccinated, you've taken the most important step to protect yourself from severe disease. And for that, I thank you, because you also helped protect our hospitals and our health workers. Our most recent data show that unvaccinated people are over 8 times more likely to be hospitalized compared to those who are vaccinated. Thankfully, our overall data show a real decline in both cases and hospitalizations, and that is because New Yorkers have stepped up once again to protect themselves and their city. Now it's time to stay up to date. If you haven't already gotten your booster dose, please join the over 2.5 million New Yorkers who've taken that important step. I'd like to see cases and hospitalizations plunging rather than plateauing. With vaccines, high-quality masks, tests, and a little more fortitude in the face of fatigue, we'll continue to shape our curve, beat back Omicron, and save lives. Thank you, sir.
Thank you, Doctor.
We're going to start with on-topic questions. We're going to do a few here in the room, and then we're going to move to WebEx. On-topic, Julie?
Yes, good morning, Mr.
Good
Mayor.
morning.
And a question for you and the Chancellor. So are you attributing COVID, or what do you attribute this 25% lack of attendance at schools? What's going into that?
2 things. Our exploration of anything remote is to target those children who are infected, and we want to isolate them. That is our conversation with the UFT and others to look at exploring. Those are our target groups. It is not just to send a signal out: if you don't want to come to school, don't come to school. No, our schools are open. And we consistently stated that the safest place for a child is in school. And so we are digging down into the numbers to find out those children who are not in school, that are not positive, to see if there's some things happening at home that we need to give assistance to. We're going to partner with the Deputy Mayor of Health and Human Services to make sure that we're finding those children and getting them back in school. You know, for instance, we had a young 15-year-old girl who was struck by a school bus. She was not in school prior to the holiday. We need to identify, find these children, and bring them back. It may come education with their parents, whatever we need to do. We must have children in school. Those who are positive that we need to quarantine, we're going to try to find a way to get information. That is what the Chancellor, UFT, and others are attempting to do. That is not for the general population, and we want to be clear on that. David, you want to add anything?
Good morning, Mr. Mayor.
Good morning.
Also wanted to talk about the, I believe the schools rolled out a new policy regarding a meeting with teachers and being able to access some material online. And I wanted to know if you could talk about just the policy in general, but also want to address the possibility that it might affect how those absentee rates are being recorded. Because if you're not sick, but for whatever reason you're being kept at home, but you're being marked present, I guess I wonder how you are going to discern those possible differences between kids who are maybe testing positive and need to stay in school at home, or those who are just being kept at home by their parents.
Sure. Well, there's been a long-standing policy that preceded this administration, which allowed for students who had tested positive and who were quarantined to receive a level of asynchronous kind of assignments Essentially, what that means is teachers would post assignments online, offer up a certain number of office hours. We're paying the teachers for that additional level of work. We offered up a little bit more clarification and an option for some more students to take advantage of that policy if the teachers in those individual schools were so inclined. What we're doing is we're trying to bring more and more of our students back. It kind of goes to the question that you raised earlier. People have been concerned, and we want them to know that the school is actually the safest place, but we wanted to at least provide, as an on-ramp, if you will, some additional students who would have an opportunity to do this asynchronous learning and to maintain their attendance in doing so. And so we think it's a way to continue to encourage more students to come back to school, and that's the way that we're progressing on that at this point.
A question for the mayor. Hi, good morning.
Good morning.
So you said that most cases are mild, and I've spoken with some people recently whose cases weren't that mild. You know, they were sort of out of commission for several days, couldn't stand up. So are you concerned about those folks who are having more severe responses to Omicron?
Yes, and I'm glad you said that. I said most cases. I didn't say all cases, and that we need to be clear on that. There are cases that are not mild, particularly those who are not vaccinated, not boosted, those who have pre-existing conditions, comorbidities. Those cases we need to zero in and give them the support that they need. And when you look at the number of cases, and I'm sure the doctor would agree, if you are vaccinated, boosted, and then did not have serious pre-existing conditions, you experience milder cases of this strand. And we are going to continue to monitor those children that are dealing with more severe cases. That is what the chancellor is examining. How do we zero in and target them? To make sure that we get the overwhelming number of people who can't come to school because they are positive cases. But of course, we're concerned about all of New Yorkers. We know that COVID has impacted us all. And those who are dealing with severe cases, we want them to have the medical treatment they deserve, Dr. Katz's coordination in doing so, to make sure we target all New Yorkers who are impacted by COVID.
To clarify on the remote option, is this something that's going to be rolled out by the central office in a formal policy, or is it going to be sort of patchwork, a teacher by teacher decision? Are you still looking at the live streaming option that's been so controversial?
We've been meeting with the leadership of the UFT, Michael Mulgrew, and the CSA, Mark Conazero, which I just want to take a moment and tell you, they have been amazing partners in all of this. And we could not have asked for better partners to help us in this path forward. We have not announced a remote learning option, if you will. We are exploring the possibilities of the expansion of a remote learning option. It was reported as though this has already been announced. There's not been any announcement what we're doing, because to turn around and do a remote learning option is not an easy thing to do. For those who've worked in schools, it requires the reprogramming of school schedules, teachers who would be dedicated to teaching just the students who are learning remotely. It is a big undertaking, even to do it for a short period of time. That is why we've been having these conversations. And if there's an announcement to be made in the coming days, we'll certainly make that. But there is no remote option that is actually prepared to be announced at this time.
We're gonna go to WebEx right now for on topic, and then if we have time, we'll come back for off topic.
The next question will go to Katie Honan from the city.
Hey, good morning. Can you hear me?
Yes, I can. Good morning.
Good morning. I'm just down the hall, but I'm coming to you virtually. My question is, I guess today is the state budget will be revealed. I'm curious who City Hall has. I know within the Albany legislature. I don't know if you have anyone working with Albany, and if you have any early indication as to how the budget looks for New York City.
Our team is communicating with Albany. The first deputy mayor, Amazing Lorraine Grillo, is communicating with Albany, and we don't want to upstage the governor. She's going to roll out her priorities that will also impact what our ask have been for New York City. And I think that we should allow her to do her announcement, and then we will give a clear presentation on what we are looking for New York City. But we met with the governor and her team, and the talks have been great, and we want to continue this collaboration that I have developed with Governor Hochul, and we think that this is going to be a great year for New York.
Our next question goes to Andrew Siff from WNBC.
Good morning, Mr. Mayor, and all the gathered folks at City Hall. On the issue of attendance, the most recent figure was 75% school attendance on Friday, and that suggests that about 200,000 kids are not going to school. How do you put that number in perspective, and how are you going to be able to make up for whatever lost learning is taking place, given that there isn't even an asynchronous option for these kids not showing up now?
Right before the new year, the attendance was 63%. Right after the new year and this administration began, it bumped up to 65%. And it has been steadily increasing each day. I think that's important to note. Our families have been concerned. And the message that we have been promoting over and over again, which is based on the science, the safest place to be is in school. And so our most recent data, with all the testing that we've done and the 25,000 cases, only 1% of those are positive cases. Those are incredible numbers as compared to the general population. So that is a message that we will continue to let every one of our teachers and our students and our families know. The safest place that you can be is in school. Now, the issue of learning loss is something that's going back a couple of years since this pandemic began. And so there are a whole host of strategies that we're going to be talking about, we're going to be unveiling in the coming days and weeks. But again, I think the biggest message is that we are trending upward. Our students are steadily coming back to school. I think you will continue to see the numbers go up over the coming days and weeks as our students and their families gain even more confidence with what is happening and what you're hearing as it relates to the science and the leadership of this administration and all the strategies that we have put in place in our schools. It's working. The comeback for New York and the comeback in our schools is happening.
Our next question will go to Abu from Bangla Patrika.
Hello, Mayor. How are you?
Quite well. How are you doing?
Good. Thank you so much. My question is about heating. As the horrendous incident happened in Bronx, is city thinking about any new initiative to make sure that people are getting enough heat and they are not bound to use any kind of additional heaters?
It was breaking up for me. Did anyone? Space heaters. The legislation that was announced yesterday with Senator Gillibrand and my good friend Congressman Torres is to really zero in on how do we use technology to identify those landlords who are not properly supplying sufficient heat for residents. We have been using an antiquated method. I've long believed that we could use the Heat Seek tool that allows us to monitor ongoing heat and heat complaints to correlate between those landlords who are not giving the proper amount of heat. And also, we've heard great ideas as automatic turnoffs for those portable heaters. In this case, it is believed that preliminary reports are stating that the portable heater may have been on for over a 24-hour period. And there should be automatic shutoffs if cases like that. And so it's imperative that we use technology for those who want to use legal space heaters. They should have safety mechanisms to assist families that we don't have a tragedy of this proportion. But it starts with supplying the right amount of heat. We can do that and ensure that if we look at those who have a history of heat complaints using the technology, I think that it could be extremely helpful. And we want to double down on this technology under this administration. It's something that I introduced with Congressman Torres when he was the council person, and we want to continue to make sure that technology are in the homes that are needed.
We have time for one more question here in the room for off-topic. Maybe you want to?
Hi, Mr. Mayor. Good morning. I wanted to ask about Phil Banks' trip out to LA after Eric Garner's death. Was that an appropriate trip to take? And can you talk about, like, you know, over the course of you being mayor, when you go out of town, how you plan to handle kind of the political tripwires associated with that?
I'm not sure of the trick wires, but listen, Phil Banks, as well as the other appointments that I made, are the best people to do the job for New Yorkers. His trip to LA on vacation and other things, I know what I must do for this city. I must appoint and hire the best talent to do the best job and make sure taxpayers are getting their money's worth. And Phil Banks is part of the team that I am putting together, and I'm happy of the team, and that is my response to that. He's the best person to assist me in coordinating all of my law enforcement agencies so we can create a safe city that I state over and over again. Our prosperity is going to be based on public safety and justice. That is what I'm focused on, and Phil is the best person in that area to do so, and I'm happy that I made that appointment.